Good morning, my name is Miranda. I'm a registered nurse and I'm a student in the RN-BSN program through MUW. Today I'll be doing a presentation on antibiotic stewardship. I know some of you may not be aware of what antibiotic stewardship exactly is, but hopefully by the end of this presentation you'll have a better understanding. So we're going to start off with antibiotics, know the facts. Just some objectives specific to this topic. By the end of the presentation, all participants will be able to state 3 illnesses when antibiotics are not needed, as well as list 3 illnesses that are caused by bacteria, list 3 ways they can protect themselves and the community from antibiotic resistance, list at least 3 illnesses caused by viruses, and explain how to correctly take antibiotics. So, what are antibiotics anyways? Some of you may know the answer to that question, but they are medications that help stop infections caused by bacteria. Before scientists discovered antibiotics in the 1920s, many people died from minor bacterial infections. Some antibiotics work on many different kinds of bacteria, and these are referred to as broad-spectrum antibiotics. Some antibiotics target specific bacteria only, and these are referred to as narrow-spectrum antibiotics. As antibiotic resistance increases, these life-saving drugs do not work as well as they once did, and successfully treating common infections becomes more difficult. So here we just have a reminder. Bacterial infections, you can use antibiotics for these. If it's a virus, antibiotics will not be effective. So bacteria, antibiotics may help, and viruses, antibiotics will not help. So you might ask, what do you need to know about antibiotic stewardship? It is a coordinated program that promotes the appropriate use of antimicrobials, including antibiotics. It improves inpatient outcomes, reduces microbial resistance, and decreases the spread of infections caused by multi-drug resistant organisms. An example that you may have heard of a specific infection would be MRSA, common in the hospital. Some interesting facts: antibiotic resistance is a growing problem both in the United States and across the world. The main driving factors behind antibiotic resistance are the overuse and misuse of antibiotics. So just some reminders here: antibiotics cure bacterial infections, not viral infections such as colds or the flu, most coughs and bronchitis, most sore throats, and runny noses. Taking antibiotics for viral infections will not cure the infection. It will keep other individuals from catching the illness, and it will not help you feel better. Some possible side effects and/or adverse reactions from taking antibiotics can include vomiting, severe watery diarrhea and abdominal cramps, allergic reactions, rash, vaginal itching or discharge, white patches on the tongue. So this right here is from the CDC. It just says improve antibiotic use to combat antibiotic resistance. It's just saying that 70% of prescribed antibiotics are sometimes not, they're usually necessary, and 30% are unnecessarily prescribed. Okay, moving on to how antibiotic resistance happens. 1, lots of germs. A few are drug resistant. 2, antibiotics kill bacteria causing the illness, as well as good bacteria protecting the body from infection. 3, the drug resistant bacteria are now allowed to grow and take over. And 4, some bacteria give their drug resistance to other bacteria, causing more problems. So just some Q&A. What is antibiotic resistance? It is the ability of bacteria to resist the effects of an antibiotic. It occurs when bacteria change in a way that reduces the effectiveness of drugs, chemicals, or other agents designed to cure or prevent infections. The bacteria survive and continue to multiply, causing more harm. So, why should you care about antibiotic resistance? Antibiotic resistance has been called one of the world's most pressing public health problems. Antibiotic resistance can cause illnesses that were once easily treatable with antibiotics to become dangerous infections, prolonging suffering for children and adults. Antibiotic-resistant bacteria can spread to family members, friends, and coworkers and may threaten your community. Antibiotic-resistant bacteria are often more difficult to kill and more expensive to treat. In some cases, the antibiotic-resistant infections can lead to serious disability or even death. So, you might wonder why bacteria are becoming more resistant to antibiotics. Overuse and misuse of antibiotics can promote the development of antibiotic-resistant bacteria. This is how repeated use of antibiotics can increase the number of drug-resistant bacteria. And what they mean by misuse of antibiotics is taking them for the wrong reasons, like taking them for a virus, and that's not what they're used for, or maybe letting a friend take your leftover antibiotics. That's something you should never do. Always take the full prescribed course that your doctor instructs you to take. Antibiotics are not effective against viral infections like the common cold, flu, most sore throats, bronchitis, and many sinus and ear infections. Widespread use of antibiotics for these illnesses is an example of how overuse of antibiotics can promote the spread of antibiotic resistance. Smart use of antibiotics is key to controlling the spread of resistance. So this is just saying that 1/3 of antibiotic prescriptions are unnecessary statistically. This is a slide on C. diff. It's Clostridium difficile. There are approximately 250,000 infections per year. This is most commonly seen in hospitals. 14,000 deaths annually, and over $1 billion in medical costs per year. Exposure to specific antibiotics is linked to the development of certain strains of antibiotic-resistant C. diff, one of the fastest growing bacteria superbugs, according to a new study. Antibiotic exposure is arguably the most important risk factor for C. diff infection. So what can you do? When you use antibiotics appropriately, you do the best for your health, your family's health, and the health of those around you. So you can ask your healthcare professional about what you can do to stop or slow antibiotic resistance. Let them know you're concerned about this issue. Ask your healthcare professional if there are steps you can take to feel better and get relief from your symptoms without using antibiotics. Sometimes the best treatment for your illness may be relieving your symptoms, not an antibiotic. Take the prescribed antibiotic exactly as your healthcare professional tells you. If taken improperly, antibiotics are more likely to cause harm. Remember to safely discard any leftover medications. So, what not to do. Never take an antibiotic for a viral infection like the cold or flu. Antibiotics do not cure viral infections such as colds, flu, most sore throats, most coughs and bronchitis, many sinus infections, many ear infections. Never pressure your healthcare professional to prescribe an antibiotic. Never skip doses. Never save antibiotics for the next time you become sick, and do not take antibiotics prescribed for someone else. So, what antibiotics can and can't do. Most bacteria that live in your body are harmless. Some are even helpful. Still, bacteria can affect almost any organ. Fortunately, antibiotics can usually help. These are the types of infections that can be treated with antibiotics. Just to list a few, some ear and sinus infections, dental infections, skin infections, meningitis, strep throat, bladder and kidney infections, bacterial pneumonias, and the whooping cough. This is just an image of like a superbug. So it says, "Hi, I'm MRSA, that which," let's go back just a second. "That which does not kill me makes me stronger." So you just see all the, you can zoom in, different antibiotics going into it here. If you need any of the resources that I use, they can be found on the CDC website or antimicrobialstewardship.com. And I have one video to finish up with. If you want to zoom in on the video, you
Hi there. Did you know that 70 years ago, penicillin saved countless lives in World War II? Fast forward to the 21st century, and the chief doctor in the UK calls for antimicrobial resistance to be put on the National Risk Register and be taken seriously. And the US government describes antimicrobial resistance as one of our most serious health threats. In Canada, outbreaks of superbugs frequently make headlines because they kill patients. Antimicrobial resistance isn't a new phenomenon. All germs have the ability to develop resistance, but the more drug exposure there is, the faster resistance develops in people, animals, and agriculture. We now face infections that are resistant to many, if not all, of our available drugs, and there is very little to look forward to in the antibiotic development pipeline. Since 2010, only 3 new antimicrobials have been approved for use in Canada. This means that we must manage these precious resources more wisely, like preserving clean drinking water or halting global warming. Inappropriate or unnecessary use of antimicrobials is often cited as up to 50%. Misuse of antimicrobials is risky to patients. It can increase mortality, time spent in hospital, and lead to collateral damage, such as a new infection with another bug, like C. difficile, a germ that causes diarrhea in most but may cause serious or fatal infection in others. Using antimicrobials appropriately will not only help preserve our antibiotics, but will also improve patient outcomes and patient safety. Everyone wants to do the best thing for their patient. Sometimes that feels like wanting to give the strongest, broadest spectrum antibiotic. But we need to ask, is that really the best thing, not just for this patient, but the patients in the global community? We need to carefully think about why we are giving an antibiotic, what drug we choose, and how we are using it, dose and duration of therapy. We are falling behind the curve with the prevalence of multi-drug resistant organisms and the lack of new and innovative antimicrobials. Antimicrobial stewardship is just one facet in the efforts to improve outcomes among patients with infections and reduce the incidence of resistance. Everyone plays an important role as good antimicrobial stewards.
Okay, thank you all for listening and participating. I really appreciate it. And that's it.
Yay, Miranda!